currently working on is one that's actually been being done by the Minnesota Department of Health. Actually Nexus is also the organization that's doing the community engagement process for that. And it comes out of the issues around the health equity report that were obviously pretty biting in terms of health equity in Minnesota and the structural racism that exists with that. And so our area is actually in energy and environmental work and come from the environmental justice movement. Long time working in environmental justice, and just for those who may not know, hey, Kristen, who may not know about environmental justice, the environmental policies that did happen, and they were passed. Much of the environmental legislation was passed in the early 1970s, and Richard Nixon did happen to be the president at the time. But you saw a whole slew of environmental policy, including the National Environmental Protection Act, which created a lot of the EPA, and which created the process which Karen identified. The problem being, of course, that as the years went on, what we continually saw over the next decades was that environmental policy did not really address the structural inequity issues that were at play. So what we saw is as we got more and more environmental policies, what we were getting was worse and worse in terms of environmental issues with specific communities, particularly communities of color and low-income communities. They were the places where industry was being sited, where the permits were happening, where transportation highways were running through neighborhoods, where unhealthy kinds of chemical toxins were being released, where redevelopment was happening and not necessarily cleaning up, where brownfields existed, you name it. And so people from environmental justice communities, communities of color and low-income communities finally said, from the bottom up, said enough. If we have environmental policies in this country, then first and foremost, those environmental policies must protect everyone. It's as Lisa Jackson said, if we believe as Americans that a clean environment, clean air is a right, then we must believe that it's a right for everyone, not just for those that have the income to move to places and communities that have clean amenities. So, easier said than done, right? Because a lot of the environmental policy and legislation, including EIS statements and all the rest, were structured in a way not to address place-based environmental issues, contamination issues, and also were constructed in a way not to address the cumulative, the overall impacts in a particular place of what happens with those kinds of industries and practices. So, for example, somebody can get a permit to pollute and be within the legal framework of polluting a particular emission that's been established by the EPA, and another business can get another permit for that same neighborhood, and another business can get another permit for that same neighborhood, and another business can get a permit to pollute in that same neighborhood. There is nothing that prevents anything from looking at it from a cumulative standpoint, that all of those different industries together are impacting that particular place. Nothing right now on the books anywhere that can prevent that from happening. The MPCA, Ned's here from the MPCA can't stop that, right? And so what community said was, even the way in which our laws and our policies are structured, our EIS statements, all the rest, are individualistic. They do not get at the real problem, the reality of the problem that people are experiencing every day. They are experiencing multiple forms of pollution, multiple forms of air emissions, multiple forms of soil contamination. They are also experiencing, if they don't have access to good food that is not healthy and perhaps also contaminated. All of those things, the transportation, the highway systems are real close. So the emissions from vehicular traffic, if you live within a quarter-mile buffer, is also significant. That's impacting people. So there's all of this happening, and there's no mechanism for addressing the overall health of those structural inequalities on a community. So what we've done, and part of the reason we're involved with this MDH-HIA, is that we began looking at what are some alternatives that our friends around the country, environmental justice communities, are working on that can start with a very place-based. In other words, we start with the assumption that people who live in a community actually may like that community. They may not want to move. They want that community to be healthier. So to become healthy and to live in a healthy community should not mean that you have to move to another community in order to do that and leave this community as being a sacrifice zone for all the rest of the contamination. So we start with that premise that every neighborhood should be healthy and sustainable, right? Environmentally sustainable. The question then becomes, how do we get to that state with inequalities? And I know Larry, you had that thing, and it had 10%. I noticed 10% for environmental. I know that was Pew's. I contest that 10%. I know.
What does this one say? 10%.
10%, right? Because we have come from a framework of health being a behavioral and individualistic. We have not. It's been an uphill struggle to look from in the health community to look at the environmental basis of health, which is all of these things. So what we did is we actually worked with friends across the country who, from a bottom-up perspective, in California is our go-to folks. There's a lot of environmental justice organizations there. We work very closely with them. And they developed this model called the green zones, right? And what it is actually developed from the community. From the community, they said, we want our neighborhoods to be sustainable. We want the legacy of this place and this community to be sustainable onward. And so how we define that is we want to figure out a way that we prioritize those communities that have the highest environmental risk associated with them and develop a program that says this place, this area, should have a priority in terms of sustainable investments. That includes things like energy efficiency resources, which there are an enormous amount these days in terms of energy efficiency. They're not going to neighborhoods that are low income largely or communities of color. That includes green jobs and green business development. That includes public transportation systems that are not based on the car, but also are sustainable in the long run and have access to that place. That includes housing that isn't lead-based, right? That doesn't have lead issues, that doesn't have indoor air quality issues. I mean, there's a whole range of things that they identified that goes into creating what it means to have a sustainable place. And that all of those things, whether it's housing, transportation, health resources, infrastructure, parks, all of those things, in order for us to move in this country to a more sustainable system that everybody should have access to, that we should designate these things. That's what the green zone concept is. You designate a place based on their highest need in terms of the unsustainability that is in that place, and then figure out to create a whole system of resources that can be invested in there. So the green zones is not a specific policy, right? But it's a program for how to get all those resources into a place-based way, prioritization. That therein, because one of the questions says, what are the challenges? That therein is one of the challenges. Because what we found is so much of HIAs have been focused on particular policies. Like there's a policy being, right? And so how does an HIA then impact how that policy may impact the health of the community? In this instance, we're being much more proactive and kind of much more structural in saying not a particular policy, but how do we develop a health impact assessment that really looks at all the indicators, that can develop all the indicators of what a sustainable neighborhood should look like. And how do we develop the indicators to identify where the gaps are? How does a neighborhood not meet those healthy indicators? And so that we can prioritize to bring those resources into the community. That's a much more difficult and much more elusive process, which I think we have a wonderful set of stakeholders. It's the HIA is actually for the Phillips neighborhood. We have great stakeholder community input in the process, but I think what's a struggle with folks, and particularly for folks who have done HIAs before within MDH, is to figure out, but what's the policy? Just give me the policy, right? And that's wherein lies the challenge. I mean, I think it's a good challenge because at least people are thinking about it. And we have to figure out ways in which we then can tackle this and sort of tackle the permitting process that goes into play for pollution, tackle the housing investments that go into play. All of that is a part of it. So we are also in the middle of it. We don't have any conclusions. We have developed a whole set of health indicators that we think MDH should be developing to look at this, and let's see what happens with it. But we're kind of hopeful that at least this is the beginning. Even if the HIA doesn't come out exactly where the community wants it, at least it's a beginning point, right, for us to move forward to the next steps. So that's our HIA.